A family's fight to get their mother the medication they say she desperately needs. They called Fact Finder 12 after insurance denied her medicine that had previously been approved and has since left them paying over $1,000 out of pocket in the meantime. Investigator Dylan Domingue spoke with the family and shares their story.
Christina Novak was living a healthy life, but her family tells me all that changed after she had hernia surgery in the spring of last year. Post-surgery, they say she developed a condition called hyponatremia, where she has low sodium levels, causing her to feel sick, dizzy, and end up in the hospital. And while she battles her physical condition, her family is in a battle of their own with insurance over getting her medication approved to treat her condition.
Helpless is not even an appropriate word to describe how I feel, especially as a nurse.
Krista Gann is used to helping her own patients working in the medical field, but recently her work has been closer to home, having to take care of her mother.
We have all of this that shows she needs it.
It's among this pile of paperwork, from hospital visit summaries to medical records, that Krista says is proof her mom, Christina, needs specific medication to keep her healthy and out of the emergency room.
She couldn't even go one day without some sort of medical intervention.
That medication, Tolvaptan, originally prescribed by doctors and approved by Christina's insurance, Blue Cross Blue Shield, in August of last year. For a year, Christina took Tolvaptan, and her family says her life went back to how it was before. That was until her prescription ran out, and she tried to get more.
Yeah, when we went to go renew that prescription in August of this year, they said no.
Needing the medicine, Christina filed an appeal. This response from Blue Cross Blue Shield shows the insurance company told her the denial for Tolvaptan was being upheld, calling it a medical necessity benefits decision and saying the denial is based on medical documentation and does not support long-term use of Tolvaptan.
Yeah, it's been proven time and time again that she needs this.
Christina continued to appeal, but while waiting for an answer and not having her medicine, she ended up back in the hospital, sick. Her daughter, Krista, says it was the one place they could go to receive Tolvaptan. You're essentially bringing your mom to the hospital, admitting her to the ER, just so she can get that medication right now.
Yeah.
That led to Christina's doctors reaching out to her insurance, asking them to reconsider their decision. In this letter, her doctor wrote to Blue Cross Blue Shield. He called the denial frustrating and time-consuming, despite repeated efforts from their office to get the medicine approved, including a peer-to-peer review with the insurance company. That letter was sent last month. To date, Christina and her family still waiting on answers and an approval.
And trust me, insurance company, I don't want her life to depend on this medication any more than you clearly do not want her life to depend on this medication.
In the meantime, the family is paying out of pocket and having to travel out of state to pick up her medicine. A 30-day supply of Tolvaptan recently cost them $1,900.
If you would like to donate and help us with that, the link is in my bio.
Christina's family is using social media to help raise the money. Her daughter, Kinsey, shared their story to her 1 million followers on TikTok. And while they say they are thankful for the support they've received, it's not a long-term solution as they wait and hope for insurance to approve the medicine.
The clock's ticking to the next when her medication runs out.
Now, we did connect Christina to U.S. Senator Jerry Moran's office, who is monitoring her case right now with Blue Cross Blue Shield of Kansas. We did reach out to her insurance company to ask what the next steps Christina should be taking in her case, but have yet to hear back. As for the family, they're working to help Christina set up an appointment with the Mayo Clinic to find solutions so she won't have to no longer rely on medication.